Hi, happy Sunday. This video is an introduction to the course that I was hoping to do via Google Hangout last week but was unable to. I will be posting some Google Hangouts for the next coming months that will just be more of my office hours and an opportunity for you to connect face to face with me. I'm asking you, though, not to wait till those times. If you have any questions or concerns or just want to talk through any of the course content or the learning opportunities that are available for you before then, please contact me on my Gmail account, my U of M account, or through my phone. I really don't want you to wait until something is concerning you so much. So please do reach out to me. This course was conceived of about 8 or 9 years ago when I was asked to come to the university and attend a meeting with Mary Jo Kreitzer and the College of Design, and I believe the School of Nursing was also included at that time. And we were looking at creating a healthcare design and innovation certificate program. The first course was going to be this creating optimal healing environments or optimal healing environments. And so Mary Jo and I have been teaching that course for 8 years now, and we've finally now got the practicum up and running this year, and so some of you are also in that. And I'll have a separate video for that as well on that course website. So the intention of the course was always based on a framework that we envisioned, Mary Jo and I. This is my very high-tech drawing. People, place, and process. And you can have interaction that occurs between any two of these concepts, but really optimal healing, full optimal healing occurs when all three of those are interacting together. And let me give you a good example of that I gave to some of the students that I had talked with earlier. I was asked to speak at a meeting in India about 4 years ago, and had a wonderful opportunity to go out there. And I was I was there talking about research on the built environment as their infrastructure is now starting to be built around India. We were at the All American India Medical Center. It's the main public hospital, or the only one, I think, for all of India, for all of Delhi, New Delhi, and the surrounding areas. And as we went on a tea break, we went outside to go to the tent where the tea was being served, and there was a man walking by with a monkey on a leash. And of course, being the animal lover that I am, I said to my friend there, well, I really want to go pat that monkey. And he's like, don't go near the monkey, he'll bite you. He's not a pet. And I said, well, what is he for then? Because he's walking on the hospital grounds. And he said his role is to help decrease the amount and presence of these small monkeys that go around the hospital grounds and break through the windows looking for food. And they've been known at times to break into the operating rooms during surgery. So he said these larger monkeys, if their presence and their scent is placed around the building and inside the building as well, it keeps the small monkeys, destructive monkeys, away. As I became to know some of the administrators there through my short stay there, I began to realize that they actually had some really incredible outcomes. They have a 700-bed hospital, and for every bed they have about 70 people waiting, some of them outside the hospital, to get in. They also have a lot of family members attend, and so the family members sleep sort of like the parked cars would, on an angle on the streets. They cook their food out there and perform all the other activities of daily living outside on the streets within the medical center, but on the streets in the medical center. So you can see from that example that while they have some really good outcomes, they're really working their people and process really well, and they've really got that really locked arm in arm because they have to, in order to produce, in order to be able to supply the demand that there is for healthcare, free healthcare. But if we could provide a place for them, that their hospital was built like in the 50s, it was very antiquated. And if we could provide a space that would support staff, help decrease workarounds for staff, create efficient work environments, and also healing environments, having family engagement in the rooms, having family have spaces to stay in and sanitation to take care of their needs, then I think you can start to conceive of how this optimal healing environment framework works. I want to next talk about the course assignments. Weekly there will be discussion blogs, what I call discussion posts or blogs, and each of you are required to go through the readings or the videos for the week, and then the question pose is related to the readings of that week. And to get full marks for the discussion post that you do yourself, it should have some length to it, not, two really good paragraphs, three really well-written paragraphs, and then citations in them from the readings. That's the big key to getting full marks. And then you simply have to respond back to another student as it's directed in the discussion question. So if you respond just to two people, you don't have to have citations in that, but in your original blog or your original discussion post, you have to have citations. That's how I grade that. And then there are weekly Discover assignments, Explorers of the World assignments, and I'm going to talk about them in the context of the final paper. So if you should really read the final paper requirements, because it is asking you to analyze and synthesize and make recommendations for transformation of a space. And those weekly assignments are intended to be done in that space. So that will help you build up your repertoire of information about that space, and also help you look at analyzing that space in different ways. So most of the Explore assignments are based on that space that you would have identified. If you don't have a space in mind, you can ask in the student post on the website if others might have something available to you. Maybe tell them what you're interested in. We've had students do exam rooms, we've had students do clinic waiting areas, we've had students do corridors. Corridors are still some of the most institutionalized areas of hospitals because they're considered passing by spaces. But a student did a whole paper and examination on it. I'd really like the final paper to be something that's useful to you, that's meaningful to you. And we've even had people take those forward to their administrators later on and try to transform the spaces that they're currently in. Last year we had a great example of a student that did one in the VA in a mental behavioral health unit, and she was able to take that not just to her supervisors, but then they took it over to the county and examined the research that she had presented to them. So if there's any way this can be useful to you, I'm very excited and want to talk to you about that if it doesn't fit the traditional form. So back to the weekly assignment. So they're going to ask you to do some things like draw, photograph, and sometimes I get questions from the students about what their drawing ability has to be, and so I've created an image for you. If you can draw like this, you too can participate in this class, and that's why I mentioned to some of you in the intro blogs back to you, the introduction blogs, was that if you have small children, this is a really great course for you to take because you can draw right along with them. But seriously, I would like you to, whenever you're doing a sound map or a mapping exercise, exploration, really give me a scan or take a picture of your original document. Don't clean it up. That's really where the richness is. That's where your thought process went on in the paper, and that's really meaningful. And then you do a written analysis to complement it. So that's the Explore assignments. As we go through them, I'll post some that meet all the requirements, and so that you can begin to see what other people are doing. I think that's really important learning also from each other. And then finally on October 14th, we'll have a face-to-face day. We're going to tour two main sites. I don't know exact order of them yet, but I will let you know as soon as I do. And then we'll probably have a third optional site at the end of the day. We did a clinic at the end of the day last year because the clinic was then empty, and we had the administrator talk us through it. And it was really one of the highlights of the tour, so I'd like to do that again. So really the day is going to be on looking at analysis of some of the concepts that we've talked about to date, and then looking at it in two different contexts. And we'll talk through the day, we'll have lunch together, we'll have an opportunity to talk more about the final paper from each of you. And so that's usually how the day wraps up, and we do have some fun too. So I'm really looking forward to the rest of the term with all of you. And I will also be posting one of these videos for the practicum class. So we'll see you soon, and I'll be setting up some Google Hangouts. But in the meantime, if you need anything at all from me, I'm here. Thank you. Bye.